All right, thank you so much. The program's still much live here on independent television. I told you that we're going to be looking at COVID-19 situations one more time in the country and see measures that state governments are taking and even the federal government to make sure that the whole thing is eased off. Well, we understand that recently, just about some few days ago, the federal government, the president had to make a broadcast, approving gradual easing off of the lockdown. And we're told that from Monday, 4th May 2020, there's going to be a national lockdown from 8 o'clock in the evening, that's 8 p.m. till about 6 a.m. in the morning. So that it's on the way. That's it's going to be from on Monday. Well, to look at all this morning, we are so privileged to have two panelists here. We have Mrs. Faith Iyere, who is the representative of the World Health Organization in Edo State. So, Madam, you're welcome to this program this morning on ITV.
Thank you very much.
Yeah, we also have Pastor Emeka Ekura. He's a cleric by profession, but a public affairs analyst. So, welcome to the program soon on ITV.
Thank you, Nigerians.
Yeah. Now, Madam, let's start, with you. We hear the approval of gradual easing off of lockdown, throughout the country, and this seems not to be too okay, judging with the fact that the increase of the cases seems to be on the high side. Nigeria records about 1,000 plus as we speak now, and we're having gradual releasing of the lockdown. How do you foresee the WHO? How do you see this? Let's relate it to Edo State now.
Yes, I think it's a good decision because you cannot continue to lock down a state or a country for a very long time. The impact on the citizen will be very grim. Like in Edo State now, there had never been full lockdown. It has always been partial and allowing people to move and get essential materials. And for the federal government to come with this copying what Edo State is doing. Now for me, it's okay because if you keep people at home for too long without enough palliative, how do we expect them to survive? So you release the lockdown a little bit for people to come out and do one or few things, and then perhaps when they review the data again, they'll take another decision.
Okay. Now,
I just want to say, the figures that are going up is a good sign for us. And it's because
the figures increasing, cases increasing.
It's a good sign for us.
How do you mean?
It shows. Why is it going up? Because screening is going on. People are being tested.
Yeah, but we're talking about people contracting the virus.
No, I'm coming. These people that contracted the virus are being brought out from the community. If you don't screen, if you don't contact trace, these same people will be in the community, and the figure will be even a lot larger than what you are getting. So it's better to get the cases, bring them out from the community, and then you now later start seeing the figures going down.
All right, but let's quickly look at how is the WHO faring in Edo State as it relates to this number of increments, even as it relates to Edo State.
Yes, WHO in Edo State has been supporting the state government in this response in various aspects, but very visible in the area of surveillance. When we talk of surveillance, we started supporting the state with, first of all, persons of interest, people that came from other countries into Edo State. We got their list and decided to follow them up for 14 days. Those that became symptomatic were brought out from
Is the WHO relying on Edo State government to do their job, or WHO Edo State has their own?
WHO Edo State is a partner. You cannot work alone. It's one coordinated approach to the response. So all partners, NCDC, WHO, the state government, the local government, private sectors, it's one coordination. It's one coordination. You cannot work separately. Whatever you have to bring to the table, it has to be, you have to work with the state to ensure that this outbreak is put under control.
Yeah, the reason why I'm asking this question, there are allegations that you really cannot differentiate the WHO's achievement so far. Rather, you see what the state government is doing, and yet you have WHO in Edo State. So that's why I asked the question, are you guys relying on Edo State government to achieve what you need to do?
See, just like I said before, WHO cannot come and take over the state government's job. What every partner do in the state, and even nationally. You see, for instance, WHO cannot come out, like nationally, cannot come out and start donating things to people. They will pass through the NCDC because they are agency, they've come to support the government of Nigeria, just like we are supporting the government of Edo State. We cannot just be working parallelly. So everything we are doing, we do it together with the Edo State government. We support them technically, support them with whatever materials we want, but we will not be working in isolation. It's against the rule. Okay.
Now, Pastor Emeka Ikuga, we are looking at the COVID-19, talking about the need to gradually release the lockdown as specified by the president some few days ago. And this whole thing is kind of not too easy to talk about. We're talking about easy down of the lockdown, and we still have cases increasing. Are you sure we are moving in the right direction?
Well, let me quickly thank God for Nigeria generally, first and foremost, because everything is just to God. And also I want to subscribe to the latest development from the President of the Federal Republic of Nigeria. Our madam here made a statement that the federal government subscribed to the system of Edo State. Yes, it is true. During the earlier of this pandemic, we made some recommendations here, appealing to the federal government to easy lockdown, because we discovered that not only the total lockdown affecting more than the pandemic. How do I mean? The states where there was total lockdown, we discovered there was much more increase. Madam just made a point that it was because there were much testing, much, findings that makes the numbers increase. But of course, you can agree with me that from the onset, the index case was someone who came all the way from Europe. And from there to other people get, infected. And we begin to discover that every day the numbers of COVID-19 patients keep increasing, even in the midst of total lockdown, like in Lagos, like in Ogun State, like in Abuja. In Nigeria generally, other states are taking some easy lockdown, partial lockdown. But in the area of Lagos, Ogun, and Abuja, federal government gave order for total lockdown. And the cases keep increasing the more. So we come to discover that it was not because there was a total lockdown that makes the COVID-19 case to reduce, but rather it increased. So we advocate that making a Nigerian total lockdown will not help the matter, but rather it will worsen the situation. People will be dying out of hunger, and there is no palliative measures put in place in the area of, okay, let's improve in the area of agriculture, let there be food production, so that if things are getting worse in an increase of this pandemic, people could be helped also to eat and get their immune systems build up them up.
Now, if you should support this gradual release of the lockdown, are you sure that it's not going to be counterproductive? That's what we're trying to say here.
Yes, I quite agree, and I believe that with this easy lockdown, I mean a relaxing of lockdown, easy relaxing of lockdown, is going to help situations.
It's not going to be counterproductive.
That is not going to be counterproductive. Why I say so is because we are all together here now. we go out. We struggle to make sure we survive, even if our businesses are shut down, even if the markets, the non-essential commodities are shut down. Definitely, you will see people also put some measures to themselves to make sure if they keep to the rules of World Health Organization, the rules of NCDC, the rules of federal government, go with your face mask, make sure you wash your hands regular, keep a social distance just like we're doing here, and they also move around. You cannot tell somebody to remain in one place and you won't see one other helmet coming in. When you stay in one place for so long, you are not moving out, you are not coming in, you are not going out, you will discover that some of your systems will no longer work properly. And there is something I also observe here. I stand to be corrected. After all, our mama from World Health Organization is here. She should know better. That most of the cases they diagnose and come up with as a result and said it is positive. We've not still come to know actually what the measures that was being taken to prove that all these cases are positive. The numbers that has been given to us by the Minister for Health is actually the right figure. Because most people staying at home with one small disease or sickness or the other, and before you go to the hospital, the next thing is tested positive. Might not really be positive.
Okay, well, we'll leave her to respond to that. And also, let's look at what is going on in Edo State. You work in Edo State here, where we have testing going on, and we're told that the tests that we have now are preliminary tests, not really to really test for COVID-19. It takes, according to report, it takes an average of 3 to 7 days, before you can actually ascertain that, a patient or a victim is down with COVID-19. But in some other climes, somebody said in Senegal that what they do now, instantly in less than an hour, it is predicted, it is determined that you have COVID-19. Why can't we have such a situation in Edo State here?
Okay, thank you very much. I think the turnaround time for results has improved greatly in Edo State.
What is still the expanse of time?
Within 24 hours, you get your results.
Within 24 hours?
Within 24 hours. It used to be, within the samples that were sent yesterday, we got the results in the night. I can tell you that.
That's a good one.
Because as at yesterday, we had 29 confirmed cases.
In Edo State here?
In Edo State. But in the night, we got another result. That sample, I saw the results of samples we sent yesterday. Somebody called me from Issaquah West. I said, let them quickly go take the sample. When I was looking at the result in the night, I was shocked. Far less than, it's about 12 hours, not even up to 12 hours.
And the results, most of the results are positive?
No, not most of the results are positive. I'll tell you now, we've taken 254 samples based on the standard case definition of a suspect. When you fall into that case definition, the sample is taken just like...
What are the symptoms for the case definition? What do you have to manifest?
Let me tell you, every time we keep a little bit of change. Before, you have history of travel from abroad, one of these European countries, and then you now within 14 days you have cough, catarrh, difficulty in breathing. But now we have included other high-risk states in this country, like Kano. Now, anybody coming from Kano, Lagos, Abuja, we had cases that became positive. They visited Lagos and came back and became positive. So you look at somebody, even when the person did not go to all these places, and somebody is telling you, for the past so days, I've been having difficulty in breathing, I'm coughing, I'm sneezing, I have malaria. They take the sample and send to Iran. And you know the beautiful thing about Edo State, I'm not blowing their trumpet. What Edo State had done, I don't know of any other state in the country currently. Everything, like I said, is one coordination. We used to have only one testing center, that is ISTH. It was among the 6, Iroa. But now the state government bought another 2 PCR machines, put one in UBTH, one in Edo Specialist Hospital. They've been collaborated, so they are waiting for the final NCDC to give the final go ahead. Even so, with all that, and all the samples were taken out to ISTH, within 24 hours we get the result. So it's so fast now.
Okay, the samples you took yesterday.
And then, like I said,
yeah,
we've taken 254 samples so far, and 30 came out positive.
That's the one you took yesterday. You took 250.
No,
okay,
no,
so far.
So far.
Okay.
Those that fell into the case definition.
So what is the record in Edo State now? The positive records that we have in Edo State?
30, sir. As
30.
we speak, 30.
Active cases?
Yes, active cases, but 8 of them have been discharged.
Okay, so we have 22 left.
One died.
Okay.
Yes, 3 died.
3 died, yeah.
Yes,
yeah.
so we have 19 active cases, and they are in the isolation center. You go to Stellenbosch and General.
Are they responding to treatment?
Very well, very well. They are responding to treatment very well, very well.
Now, madam, you know, one other case that people talk about is the siting of these testing centers. Some say that is typically against, you know, World Health practice. Imagine you locate a testing center in a maternity ward. I mean, that is not, is it okay that way?
No, that's not true in Edo State. None located in a maternity ward.
We have. There are some. That's
where?
One or two places.
No, let me tell you.
There are hospitals that alternatively, they are into maternity profession. And you shouldn't have such centers there.
Sir, I'm sorry to say, in Edo State, we have 3 places where we have the centers. UBTH, Edo Specialist Hospital, ISTH, and this facility.
We're talking about testing centers. There are some designated testing centers.
That's what I'm telling you. Okay,
designated testing centers.
Those centers you are talking about, they are not testing centers. They are screening centers.
Okay, they go into the preliminary screening.
So these 3 places where you have the testing centers are ISTH. You have UBTH, and then you have the Edo Center, the UBTH and the Edo Specialists, and the one I'm saying they are coming for the final test for the machine. They are all all the equipment are already in place. Those other centers we are talking about are screening centers. People come to those places and then they screen them, and they discuss with them. Do you have this? Do you have this? Do you have this? And from there, it's okay. This one is a suspect.
Are there follow-ups?
Yeah, I'm coming. They take sample and send for testing. So all those facilities they go, they are just going for screening, and that's a standard. You come, there are no machines in those maternity to screen those people. They only have, if somebody fall into the case definition, even here now, we can go to that corner. Just, you were describing it. You take the sample, where kitted, you take the sample and send to the screening center. Okay.
Now, Pastor Emeka, what the case that is happening in Kano State, it's somehow worrisome. Some have believed that it's actually a case of COVID-19. Looking at the deaths, you know, that were recorded recently, only for even the state government had to come out to say that they are not related to COVID-19. That some of the cases turned out to be BP. You know, that's hypertension, diabetes, and all that and all that. Now, as we speak now, Kano State is observing a total lockdown. All this, how do we look at all this within the light of, you know, efforts put together by federal government, by state government to say that at the end of the day, Kano State will be free from, you know, the case happening there?
Actually, it's a terrible thing. Before federal government came up to lock down Kano State totally, of course, you agree that the rate of death in Kano State was alarming. And the government of Kano State comes up to say that it was not connected to COVID-19. And the source of the death is up to today unknown to us. And the federal government coming up with the measure to make sure if it is related through COVID-19, the lockdown should be the best way to avoid much spread of it. I think it's a welcome development. And I believe with the idea of the president and the task force on COVID-19, their recommendation and other stakeholders to the president that warrant the total lockdown, there should also be a time to review it. If with the total lockdown and the death aspect of it reduces, and the issues of contacting one disease or the other also reduces, I think it is a good measure. But if after lockdown and the review and the death increases, federal government should also find another way to make sure we curtail the issue of people dying in Kano State. But one good thing is that the total lockdown in Kano State will help not to spread the virus to other states and other communities. And another thing I also want to point out here, there is another good measure, is the coffee federal government is imposing from 4th.
That's from Monday.
On Monday.
Yeah.
So if you come to look deeply into this issue, you will come to agree with me by sense of reasoning that in the night you see movement of not just essential commodities. You see different kind of movements of different kinds of people. Like you agree with me that Lagos State is on a very high rate in COVID-19. Abuja the same. You see transporters load in the night, bring in these people, and that is what is increasing other states. In Edo State, the governor of Edo State started early here to make sure the spread of COVID-19 is curtailed. And the measures were put in place. There was no total lockdown, and you see the cases are not as high as when you talk about
other places,
the neighboring states.
Yeah.
And they good and fine, and the approach taken towards it has been helping Edo State. You can see both of us talking today. We move out, we come back home with our children, we are strong and we are healthy. But those living the Lagos State, living Abuja, living Ogun State, living Kaduna, in the night, if you go to Adoawa, you see in the night they use trailers to load a human being, and they brings it into states. There is one I watch in the social media, sometime in what they call it, Delta State. It was in the social media anyway, but I suppose it was real. You see where they transport human beings from other states to other states. For what reason? So this coffee from 8 o'clock to 6 o'clock, interstate lockdown agreed by the governors of 36 states and federal capital. I think it is a welcome development. It will help us make sure that this issue of COVID-19 is fought to a halt. So I am of opinion and support that the total lockdown in Kano State is a welcome development. But one thing again, I also want to put here, the World Health Organization should also do everything possible to find out the root of the death of these individuals in Kano State.
Yeah, investigations are ongoing.
So while investigations are going, let it be very fast. Because people are dying day after day. If it is as a result of COVID-19, we should know. If in Edo State, in other states, they are doing some tests and they are bringing some results and their tests are real, let them conduct the same test over there in Kano, to be sure that what they're doing. I read the other day, they said some centers are closed down. Why are they closed down? Are they closed down that they cannot be able to handle it?
In Kano State.
In Kano State.
Yeah.
So why are they closed down? They should be able to, the federal government should be able to support the medical personnel there, equip them properly, so that they themselves will not be a victim of COVID-19, helping those who are already positive. I think that is the why you see a lot of people dodging away from their responsibilities.
Okay. All right, so the program is still this morning on ITV. We are looking at COVID-19 one more time, looking at PNB's approval, talking about the gradual release of the lockdown and views and perspective here, looking at, sharing views and also having perspective. And we still have Mrs. Faith Ireye, who is the representative of the World Health Organization in Edo State, and also Pastor Emeka Ekura. Now, Madam, you heard about the centers. That is also one area that calls for worry. You talked about the screening centers a while ago. Now, there are allegations that the screening centers you have in Edo State are only within the metropole. We don't have them outside Benin City. You know, you have more in Benin City. If you go deep down Auchi, deep down Etsako, deep down Genibode, we don't have them. Now, how can the World Health Organization achieve so much in all of this?
Thank you very much. Like I said earlier on, the World Health Organization is in every state and in the country.
Now, we're not doubting that. We're talking about the screening centers now.
So with the screening centers, what we are doing, together with the states, we work with figures. We don't just jump into anywhere to start doing work. You find out we started, together with the states, started the screening in Oredo. As I'm talking to you, the 30 confirmed cases, 16 are from Oredo. So you can see the reason why we started from Oredo. And
but that's probably you don't try it elsewhere. So
no, just allow me to finish. Gradually we've entered Ikpoboha, Ovia, Ego, and now, next week, we are going to Esan West. From there, we are going, next week, in fact, we are going to cover all the 8 local government where we have confirmed cases. And then we'll move into the other LGs where we can also do screening. So it's a gradual process.
Now is it that you guys are short of manpower?
No,
we're talking about an ailment that takes 14 days to incubate, one would have expected that there should be an aggressive.
It's aggressive, you will not understand. So I'm coming. Let me tell you one thing. When you are aggressive, you must still use data. Use data for action. So the state government have trained over 4,000 people. I give that credit to them. Over 4,000 health workers, so doing various activities. So like I told you, by next week, we are moving to other centers, other local governments, screening centers. But apart from the screening that is going on, that's what we call active case search. Active case search with our teams going on in all the local governments. In all the local government. And the screening you are talking about, Edo State, I think, is about one of the states that have gotten the facility to do the screening, apart from the machines. The Edo State bought 10,000 VTMs, like what you were describing, where you do to.
Let's look.
So the screening will gradually, from next week, be scaled to other local government and it will cover the whole
let's look at our discussion more on WHO, because we're going to be having the Commissioner of Information, so he's going to be telling us all that information as we get along on the program. Now, we're talking about testing centers, screening centers and all that. You said that Edo State government trained a lot of ad hoc health workers now. Some people say that it ought to have been the WHO. Now, it seems that the WHO, the presence here is kind of questionable. That seems to be the question.
No, that is not true. That is not true. If you go to those screening centers, for instance, now, you see WHO.
Okay.
But when you are working in a state, you talk about the state. Like I say, it's one approach. WHO in Edo State, if you want to rate it, if you ask anybody, it's about one of the most vibrant in the country. Okay. But you cannot say WHO. Whatever we are doing to support the state. Those trainings that we're talking about, facilitation and WHO were part of it, all through. Technical inputs, materials, anything that will make the training be of quality, WHO, but we cannot be projecting WHO. It's the state. We are all one team trying to end the outbreak in Edo State.
How true is it that with effect from next week that there's going to be a kind of a door-to-door screening, door-to-door testing in Edo State? Is that correct, by WHO?
There are states where they are doing that now.
I'm talking about Edo State. Are you planning to do that?
We are not starting that in Edo State next week.
Okay. But do you have such plan at all?
The WHO prioritized. You've heard the cases in Lagos.
Okay, so your priority...
wait, where I'm coming. The They are doing that in Lagos.
So many questions.
Yes, they are doing that in Lagos. They are doing that in FCT, and I'm sure they will do that in what do you call it? In
Ogun State.
In Kano.
In Kano. But we have not gotten to that level. Edo State is on track. They evaluate, WHO will evaluate the states, all the state, whatever they are doing in the state. Do we need to go to that state to go and do this ABC? They found that our contact tracing is super, very strong. And that is where some people missed it. At the beginning, if contact tracing, they were following all their people of interest that came into the state, they are contact tracing, because when you have a confirmed case, you need to follow up all the contacts. When they become, there's a case in this state now. We are following up the case. Unfortunately, the person passed on. But we have gotten 3 confirmed cases.
Through that case.
Through that contact tracing. If we didn't do contact tracing, those people will be there, will become positive, and they will be, infecting other people. That is how you now get community transmission. It will just be flowing all over the place. So that is why the quality of contact tracing in this state, surveillance, following up contacts, bringing out these people from the community before they start affecting other people. Like the case that came in the night now. We are so glad because it's timely. People go there, our people go there every day. WHO is part of it, NCDC, all of us, to follow up these people. They went there yesterday, they just found out was having some symptoms. Quickly, they took the sample in the afternoon. And I'm telling you, in the night, we'll find out that the result is out. Fantastic.
Okay, as we wrap up now, Emeka Okuwa, you want to share more lights on some of the issues too?
I think
I wanted to say something on Kano issue.
Just let him anchor his mind. Just go on.
I want to add to this, especially to Edo State government and the people of Edo State. God has been so faithful to us, Nigeria generally. If you go to if you look at other countries, European nations, you will discover that Nigeria is really blessed. What is most important here is God help us. No matter whatever we do, we don't look unto God. That means we are wasting our time. Mama can be able to attest to this, that the COVID-19 issue, it is clear there is no vaccine. It's clear there is no cure. But I thank God she's still the one here telling us that out of 30 or 20 or 25, so numbers are discharged. What were the measures used? That means even paracetamol or whatever they put in place brings a solution. It can only be God. And yet there is no, what do you call it, no vaccine. Another thing is I want to encourage those state citizens, everyone here in this state and other states, to adhere to the rules.
The directives by the government. Yeah.
Whatever the government asks us to do, let's try as much as we can to follow it up, to do it. It will help us, because this issue of COVID-19, it sounds spiritual. And it is those who function in the supernatural that can overcome it really. That's just the truth.
Okay.
Encourage the ministers, the churches to pray more. The Muslims, the way you can pray, I've said it time without number. Pray more. It's only God who can help us out of this. The World Health Organization, with all their inputs, might give us no result if God is not behind it.
Okay, now, Madam, you said you wanted to add something to what you said.
I wanted to add something to what he said.
No, you said something. You said you wanted to add, because we're wrapping up now because of time.
It's okay. What I wanted to add is this. The World Health Organization have been supporting the COVID-19 response, providing materials, technical support to the government of Nigeria and, of course, the government of Edo State. And we will continue to, to do that. But just like what he also said about the treatment, yes, there's no cure, but the symptoms can be treated. The clinical symptoms can be treated. Supportive treatment is very effective, so they will continue to do that.
So when the symptoms are treated, the victim or the patient becomes negative?
Yes, so you need 2 negatives. Thank you, sir. If somebody
we really need to establish.
Let me just explain it to you.
Yeah.
If somebody becomes, you will see some positive people, even stronger than you. But if you don't remove that person from the community or isolate that person, the person will still be spreading it. Are you getting me? That is why there is denial. Some people will say when their result is positive, they say, no, I don't have COVID-19. It depends on the immune system of that person. But if you don't remove that person to isolate and then start treating, the person without symptoms will still be affecting.
So it is the symptoms that we treat,
so
not necessarily.
Symptoms of that we treat because it's a viral infection. It's a viral infection. It takes its course. So if the symptoms start coming like cough, you have cough, you're sneezing, it's malaria, and so on and so forth, it treats the symptoms.
The symptoms.
Yes. And you see, immune system also have a place to play. That is why you find out that the elderly,
the age factor,
and then some underlying ailments, like the three, some of the out of the three we lost now, they had underlying ailments.
Fine, I like to hear that.
Yes, underlying ailments. So, sir, I don't want to say this. People should report. And one thing Edo State have done that is very important, that I thought Kanu will do. Somebody, they called us in the night. There was an alert in the night. The person walked somewhere, I don't want to mention the name, somewhere in another state, but just came back to visit the family during the Easter. And in the night, became very sick. There was an alert. Before they got there in the morning, the person was gone. Because he called at around 1 a.m. in the morning, the person was gone. What Edo State do, we don't allow such person go like that. They still take the sample. We took the sample, and the sample became positive. And then we started following the people. I can tell you, one of the member of that household, I don't want to...
Is also positive.
Is now positive.
Okay.
If we didn't take the sample, that person... So what Kanu should be doing is that those cases, in their own investigation, if somebody pass on in a circumstance you don't understand, take the sample, you find out, at least that will help their investigation.
And do enough contact tracing.
And do enough contact tracing. What is happening at DO is contact tracing.
Okay.
And from the beginning, we started following up people of interest. And once they do that, if you miss it, of course, you have community transmission.
All right, thank you so much.
Evans, please, before you wrap it up finally, I also want to advise, especially our state governor, the state government. You see, measures have been put in place. The World Health Organization has been doing their work. The COVID-19 task force has been working. NCDC has been working.
Yeah.
I also want to say now there is a relief of lockdown.
There's an order to release lockdown by state governments.
Of May. I think the state government should also do everything possible to see how they can be able to reach out to some of these people that are only surviving on daily earning.
Yeah, when we say release of lockdown, definitely it's going to impact on, people living on daily wages. Imagine somebody that is not supposed to go out at all. Good. You now say that the person can now start going out. That's an impact.
You know what I'm talking about. Yeah. If you said relief of partial, lockdown, and somebody goes out and the shop is locked, what means with the person get
all right, so in other words, you are saying that state government should ensure that the people, the agencies, the agents that they use in carrying out these directives, that they do what they are supposed to do.
Yes.
Okay.
And
that they don't abuse it.
You discover that even in Nigeria generally, the crude oil
price has dropped
completely.
Yeah.
Nigeria will only survive by individuals now.
By alternative ways of generating income.
That's all.
Okay.
Private enterprises.
Yeah.
So if President Muhammad Buhari don't make any avenue to make sure that private firms are up now, it will be worst in the time to come.
Yeah, that's why we are saying the same thing. That's why we had that broadcast, and even in that broadcast, the president praised the SMEs, the small and medium scale enterprise owner, for despite the situation, the way they are pulling through, and he also encouraged state governments to make sure that they encourage these people in turn. So all these are efforts to see that we begin to get back to our normal way of life. Madam, thank you so much for finding time to come on the program this morning.
Thank you,
you can see we are rubbing our hands here. She had to put some hand sanitizers into. Yeah, thank you so much.
Yes,
thank you so much. All right, we'll take a short pause now so that we can get you to see other segments of the program. Please stay tuned.